We're back. You should hear what is said when the camera's not on. I got to tell you, we're back with Dan Threlkeld and Dr. John Cattaneo. Right.
Yes, sir.
Yes, I love it when I nail it. You are Dan's neurologist, correct?
Yes, sir.
All right, we're going to get into that in just a couple of minutes, the reason for having you here. Emily, would you show that the picture we talked about? This is a contrast, if ever there was one. Ironman finisher, and on the other side, a handicap placard for wheelchair folk. Dan, what's that about?
I was an ultra athlete and doing 100-mile runs and trained for an Ironman and completed that in 2006. I was training for my third 100-mile run, which was on the Mother Road. We completed 2 separate ones. But during that time, my body started changing in that. My feet were getting numb, my fingertips were getting numb, and then I had gotten very sick. And as broadcasters, you know, you push ahead, I can deal with that.
Sure.
We're men. We say, hey, I can power through this thing. We're not smart.
We only
we
cry
weren't
in the
listening to our
closet.
wives.
Yeah.
And it got so bad one night, the wife said, we're going to the emergency room. By that time, I had masked the fact and told her I wasn't feeling a lot because I knew that she would send me to the emergency room. My hands were pretty numb and feet were pretty numb. Went to the emergency room, and apparently I had a gallbladder that had been coming apart. And they had emergency surgery on me, and we found out perhaps that may have been the start of the stress on the body. But by that time, my hands were numb. I'm in there. They show me and tell me, we did this operation on you, and I'm saying, by the way, I can't feel my hands.
All right. At this point, did the doctor enter your life?
Yes, at this point in time, they were baffled, and John was on call. He was forced to see me, and John and I have become great friends, but John came in, and he was a detective, a medical detective, trying to find out what's going on.
Doctor, tell me about that period. What hit you about Dan Threlkeld?
Well, I think the first thing is the fact that he's a celebrity as a weatherman on TV, and I thought, oh boy, this is a little different, you know. But when I first saw him, I thought, I hope things go well. And I knew he was weak, and so we actually went ahead and did some nerve conductions that day. And remember, we did that. We do electrical testing at the bedside, where we shock the nerves to check the function. And sure enough, it showed up straight away.
Now this is a summer day in August.
All right, let me interrupt you right here for just a second, Dan. What showed up?
So what we do is called nerve conductions, and this is when we stimulate the nerves, and we can measure the speed of the conduction of the nerve and how efficiently it conducts and so forth. And anyway, there are specific patterns that you see on nerve conductions that can really help nail down the diagnosis straight away, along with the history. And in his case, it looked like that. So.
Well, what was the diagnosis?
Well, at that point, Guillain-Barré was what we thought it was. We got it pretty soon.
That was followed shortly
Right.
by more bad news, wasn't it?
Well, I mean, we had to treat him with IVIG, and it took a lot of physical therapy, a lot of time, and he kind of waxed and waned but he kept.
Bell's palsy kicked in.
That's right. Then, yeah, the facial weakness, and people with Guillain-Barré can have facial weakness, and that can be the entire side of the face, both sides of the face, and some patients actually end up going into respiratory failure. This can be a very serious illness, and you can't predict necessarily who's going to end up like that.
But here's a guy who's been competing in the Ironman.
I know, and it can happen in anybody, and we know that there's an association of this illness with certain illnesses. These Campylobacter is one of the bacteria that tends to be associated. People can get this after a flu shot. Now that's pretty rare, although it can happen. And it's just one of those things that just appears.
If I recall, back many years ago, in fact 50 some odd years ago,
Right.
They discovered a correlation between the live flu vaccine
Right.
and Guillain-Barré. And you had not had the live flu vaccine.
No, not at all. They thought that perhaps maybe my body in that weakened state,
Right.
somewhere in there, a flip may have switched, and that all of a sudden that autoimmune disease kicked in. I'm certainly not a physician, but my body was at its very weakest state, and that may have been the time that is the central nervous system attacks the central immune system.
So it's a peripheral nerve problem, and what happens is your body makes these antibodies that attack your own nerves, and the nerves are stripped of the myelin, which is basically the coating on a wire, like. And once you strip that wire, it can cause the short circuiting.
Because the other nerves just come together, don't they?
Right. And it can affect your heart rate. The autonomic nervous system also has fibers that are coated in what we call myelin. And if that gets stripped away, boy, that can be bad news. So
we have some video I'm going to ask Emily to roll, if you would, to show when you finally were able to get around. So you were still in a wheelchair.
Still in a wheelchair, and took a long time.
This is you training.
Yeah, fighting back. So to do an Ironman, you need to swim 2.4 miles. So I swim 3 days a week, building up. And you can't just swim it saying, okay, it'll take me a while to swim. No, you have to swim it in a certain amount of time before you get to jump on a bike. And when you get on a bike, then you ride 112 miles after immediately swimming. And then if you can make it off the bike, then you have to run a complete marathon.
Oh my gosh.
And so I train late at night or early in the morning. And so I'm fighting an older body now, a heavier body. But if someone out there is watching, just try to do it. It doesn't have to be an Ironman. It's just maybe a walk around the block.
We got about 2 minutes, and I want to know, Doctor, at what point did you, of course you couldn't sit him down, he's laying down already, but at what point did you say, here's the problem, Dan?
it was straight away. We figured that out the first day, as I recall. That was 9 years ago. So
Fairly recent. Dan, how did you receive the news?
Well, like a lot of people, I'd never heard of it.
Right.
And so John with OU just did a great job of explaining what it was in terms I could understand. Mm-hmm. And like a lot of people, the next question is, what do I have to do to get over this? And so it was a slow process. I tend to be stubborn by nature, and I wanted it to be over next week. It took months to finally get over. And I don't know that I've 100% gotten over it, but I'm slowly getting there. But again, talk to your physician, get a good physician, and I still thank John to this day.
You're in training again.
Again, May 31st, 2020, I will do Ironman Tulsa.
Wow. You know,
and I will do that. My goal is 14 and a half hours.
I was watching the night that you filled in one night at Channel 8. And I recall I looked at my wife and said, if they don't hire him, if they don't hire this guy, they're missing a big deal.
You're very kind.
And I was so impressed. And you haven't let me down, except for Friday nights when you rip your tie off.
You don't like that?
No, I like it fine.
Well, I tell you, it's kind of a celebration of end of a long week, but it's, I just want to encourage people out there. A lot of people may not relate to Guillain-Barré or Bell's palsy, but they have struggles in their life, and it may be financial or marital or whatever, but just be patient, pray a lot, and work through it. Just
work hard.
Have a big network. If you're lucky enough to have a good physician or friends around you, that helps. But just fight that good fight and work your way through it.
Doctor, we got about 30 seconds.
Yes, sir.
Is Dan doing everything correctly? Should he ease back?
No, I say he's doing great. He's phenomenal. I mean, his personality was part of the healing process that allowed it to, I think your attitude plays such a role.
I've heard that so many times.
And how hard is it to be sitting there in this bed and you're weak, but he just, he's doing great.
Gentlemen, we're out of time.
Thanks.
And I'm so sorry for that. I'd like to have you back sometime to talk weather.
I'd be honored. Wait till you get John's medical bill, though, Sam. That's coming.
Well, we're out of time, and I want to thank both of you guys. I mean, it's been an honor for us to have you, even in the studio. That's all the time we have for this edition of Perspectives. Thank you for joining us, and we'll see you next time.